On the occasion of World Liver Day, I thought we'll share some insights into common liver problems that we are increasingly seeing among the general population today. So if we look at cirrhosis of the liver, which is basically a gradual process of liver damage that occurs over a period of time, it can occur because of various causes. I think the most commonly known cause is alcohol, which still remains one of the most important causes in our country. And apart from that, the other common causes which are coming up in a very big way is hepatitis B and hepatitis C. So these are basically viral infections, which are bloodborne, and over a period of time they cause serious damage to the liver. And a lot of our patients who require liver transplant are actually patients who are affected with hepatitis B and C. So hepatitis B and C both are bloodborne infections. They can be spread either because of needle stick injuries, needle infections, drug abuse. It's transmitted by unsafe sexual practices. Basically, hepatitis B and C both are treatable conditions. There are a lot of medications available. It's important to get, of course, hepatitis B also has a vaccination, but hepatitis C doesn't have a vaccine as yet. But what is important to understand is that both hepatitis B and C are completely treatable. The other big subgroup of patients that we are increasingly seeing are liver cancers, and these can be because in the background of hepatitis B and C or in the background of cirrhosis that we're commonly seeing. It's very important to immediately contact a medical person so that we can, not all jaundices are infective. You can have sometimes cancer as a cause of the jaundice, and only if you can pick them up early can you treat them. Liver cancers on the whole are again eminently treatable conditions more often than not, unless it's very advanced. So it's important to pick them up early. In case of any loss of weight or loss of appetite or jaundice which is not being, which is not settling down, you must contact a physician immediately. Lastly, I think it's important to also realize that liver transplant today is a very well-established modality of treatment for cirrhosis of the liver. It's important to identify the patients who the risk stratification is very important, but I think basically the important thing is to pick up in time and treat in time, and most patients we should be able to treat well.